Thank you for joining us this afternoon for our presentation on training the next generation of psychologists in social justice and public policy advocacy. I am Teresa Collins-Jones, and I am the Department Chair of Clinical Psychology at the Chicago School of Professional Psychology in Dallas. And then my colleague who'll be presenting with me is Dr. Lance Garrison, and he is our campus dean. This is just a quote that I think inspires me that I thought we would start with. How wonderful is it that no one has to wait, but can start right now to gradually change the world? And we do not have anything to declare at this time. Okay, so these are our learning objectives for today. You're going to be able to describe at least one strategy for increasing awareness of social advocacy efforts. You're going to be able to identify at least one approach for increasing knowledge of public policy that impacts mental health services. You're going to be able to list 2 to 3 strategies for promoting advocacy efforts in your professional work and/or research. But before we really get started, we had a poll. There are 3 poll questions. If you guys have not answered them, we would love for you to answer them so that we can kind of talk about them later on in our program. So here's kind of a roadmap for where we're going to go today. We're going to start with the background of why we implemented a program to teach doctoral students about social justice and advocacy. And then I'm going to tell you a little bit about our pilot program and our increasing knowledge of public policy that impacts mental health services. And then Lance is going to talk to you about developing a connection between direct service and legislation, strategies for promoting advocacy efforts in professional work and research, and the next steps, where we go from here. So in 2012, Melba Vasquez, a former president of the American Psychological Association, described much of psychological science and knowledge as being significantly related to social justice. She described psychology as having the goal of decreasing human suffering and promoting human values of equality and justice. The mission, vision, goals, ethics codes, and strategic plan of APA provide a rationale for psychologists to be involved in applying our knowledge to social issues. Theories of justice are embedded within our beliefs about human rights and have led to an ongoing discussion about the responsibilities of psychologists. The words social justice, diversity and inclusion, and ethical action in all that we do are included in APA's core values. Thus, psychology training programs are tasked with bringing attention to social justice issues and to educate students on psychology's role in advancing healthcare. We need to instruct our students in understanding these factors, avoiding discrimination, and opposing unjust practices. The issue that many psychology faculty members face when developing their programs of study is identifying the best way to integrate social justice themes into our coursework, research, and clinical experiences. Given the issues that our society now faces in the mental health pandemic, we need to do more than just present this information in our classes. We need to somehow link content that we teach with social justice themes, provide opportunities for them to learn why social and political factors are important for psychological understanding, and we need to develop opportunities for students to become more aware about the issues in the communities in which they live, to see the connections between research, practice, and public policy, and to identify the importance of service learning. So, during the pandemic, as I sat there listening to colleagues and hearing stories about the lack of access to mental health services, I became really overwhelmed. I often thought of a quote by Oprah Winfrey. Yes, I love Oprah Winfrey. Difficulties come when you don't pay attention to life's whisper. Life always whispers to you first, but if you ignore the whisper, sooner or later, you'll get a scream. So I started thinking about what can I do? And for some reason in the middle of the pandemic, I'm at home, and we did not have students yet because my program started in August of 2020. So I'm working, just creating the program from home, and the idea of getting another degree sounded really great. And so I enrolled in a master's in public health program, not realizing what that would be like once the students actually showed up. So I decided to enter into public health. So here's kind of a timeline of events. Yes, I mean, I think it's just a conversation. I just want to get the conversation going. Okay, so I decided to pursue the MPH degree. And then in August, we started our first cohort. We started a doctoral program during a pandemic, and we started it virtually, not having really planned for that until the last minute. So we plug along the first 2 years. I'm in my classes in my MPH program, and I'm really starting to wonder, how am I going to help my students learn about social justice, and how am I going to embed this in our courses in a meaningful way? And then last year at NCSPP, several of you inspired me, and I sat in your workshops and I felt compelled that I have to do something more than what I'm doing. So I met with Lance, my campus dean, and I said, we've got to do something. I'm not doing enough. What we're doing in the coursework is just not enough. And around that time, I also wrote a paper in my policy class for my MPH. And instead of getting a grade in Canvas, I got a message that said, please call me. I've never had that before in my life. And I'm like, okay, I don't even have a grade. I have to call this person. So I called my professor and we had a talk. And she said, the mental health equity issue is so important, and there's no one doing this work, especially not in the state that you live, which is Texas. So we started having conversations, and she let me do all of my work in her class on things that mattered to me that would help my students. So these are a couple of the presentations, and I do want to call out, some of them are here in the room, and I thank you all. You have no idea how much you inspired me, and this workshop is probably an homage to you guys. Right? Thank you very much. So as a training program, we're tasked with presenting information about science, practice, and advocacy. We need to educate students in how to monitor and provide input into public policy, as well as foster an interest in research and program development to apply their knowledge and skills to assist in the solution of significant problems of human welfare. Knowing that advocacy is a professional value and attitude of psychologists, we decided to pick up the phone. So, how did it all start? With a Zoom meeting. So, we had 3 different conversations. Obviously, I had the first meeting with Dr. Garrison to brainstorm how we could begin talking to our students about public policy. At the same time, I was having conversations with Dr. Ellen Breckenridge she's in the School of Public Health at the University of Texas Health Science Center in Houston. And then we had a meeting between the 3 of us. And we decided that if we could teach students about advocacy, we could bring local legislators in and allow the students to learn what the legislators knew, as well as inform the legislators. So we thought, how could we create this? So we decided to have a pilot program, like a little workshop series. So just to give you some background before I give you some of the data, let me tell you about my students. We have 3 cohorts now. So I have students in first, second, and third year for a total of 40 students. I have 35 females and 5 male students, 1 American Indian, 6 Hispanic Latina, 16 white students, and 17 Black students. So we have a pretty good, they have 11 third year students, 14 second year, and 15 first year students. And this was a required seminar. They all came. I have everybody on campus on Mondays, so they all came because we also provided lunch. So these are our 3 session topics. The first one, we had meet the county commissioners. The second one, we had advocacy versus lobbying. And what I had learned through my public health classes is that public health professionals are taught how to be advocates. There are courses that you take in public policy and advocacy. So Dr. Breckenridge came and taught our students what the difference was and how to engage in it. She gave everyone direct instruction on what is advocacy. And then we had folks from our local county come in and talk about the mental health needs in our county. So here's a couple of slides that we'll talk about the topics. So in the topic that Dr. Breckenridge, in her presentation, she talked to them about communication strategies, that you need to speak as a group. You have more power when you are a collective unit, when you go and talk to your legislators, that you ask and listen to what the community wants, that you find out what information the legislators need or want, and Dr. Garrison will talk more about that. Use plain English and visual messaging, and create trust by communicating clearly and often. She also talked to them about advocacy, and she said you need to learn about existing and upcoming policies. You need to build coalitions to deliver coordinated messages. So she was talking to them about, even though we might be a separate group as psychologists from like our licensed professional counselors or clinical social workers, how powerful are we when all mental health professionals come into the room together to advocate for the needs of individuals who are not being served? To work from consensus on short and long-term goals, protect tax-exempt status or government funding, and to recognize that policy making and change are slow processes. So we wanted to know if this program is effective, how will we know if when we're helping the students learn about advocacy and policy change, that what we're doing benefited them? So of course, being psychologists that we are, we thought we needed to measure their before and after knowledge. So we started with a measure called the Social Issues Advocacy Scale 2. It's a revision of an original 21 item scale. The revision was done by Marzalex and colleagues. He's from the University of Missouri, Kansas City. Super nice. When I reached out to him to ask if I could use his instrument, he sent me not only the instrument, but every article that they've published on the instrument. Super helpful, very helpful. So the original, the revision sought to kind of go beyond the four dimensions. There's the political and social advocacy, participation advocacy issues, political awareness, keeping track of relevant legislative issues, confronting discrimination, conceptions of professional responsibilities for confronting workplace discrimination, and social issue awareness, attribution of social inequality to structural factors. And it was rooted in a definition of social justice proposed by Constantine and colleagues in 2007, where fairness and equity are valued for marginalized individuals and groups. And in the definition of advocacy, they focus on action that is directed towards changing or transforming the process by which public decisions are made. So the questions that you guys took in the poll, those are 3 of the questions from the SIAS 2, by the way. So these are the 8 areas of the SIAS 2. So these are the subscales. You have relationship building, political awareness, social justice, self-efficacy, confronting discrimination, political and social advocacy, social justice identity, willingness to confront injustice, value of community commitment, sense of community responsibility, and social issue awareness. So prior to starting our seminar series, we had all of the students complete the SIAS 2 through Qualtrics, and these were their first initial evaluations. This is all the cohorts together. We have not pulled it apart by cohort, but this is everyone together. But you can see the one that was the lowest was political and social advocacy. That was where the students felt that they were the least comfortable. So the instrument, it's actually a Likert scale. And you are saying whether you never, occasionally, fairly many times, very often, or always engage in these actions. So these are the post-test, the post-seminar. It changed slightly. So everything moved up. One of them is significant, but we want to see what happens 3-6 months after we end it. We did this the day that we ended it. So we would love to see if ongoing efforts and all start to make more of a difference over time. So their knowledge of advocacy improved. However, as our program was very brief, we were 3 sessions over a 2-month period. We plan to include additional exposure to policy issues this next year. We're going to create opportunities for the students to observe modeling of interactions with legislators. And we also would like to develop some cross-discipline training where we bring in some individuals from other disciplines and work together collaboratively. One of the things that did come out of this is we have a graduate student organization. They named themselves Psyched. I let them name themselves. And they decided to have committees, like to develop committees. And one of them they decided to develop this year is a social justice and advocacy committee. So we now have 12 members out of 40 students. So they are very excited to become involved. So now I'm going to turn it over to Dr. Garrison.
Hello, everyone. Thank you, Dr. Collins-Jones. I think we will get started. Hopefully you had an opportunity to take the poll, and we'll take a look at those polling results. So that first question was, I keep track of important bills and legislative issues that are being debated in Congress that affect my profession. Majority answered yes, you can see that. 33 of the 52 responses keep track of important bills and legislative issues being debated. 19 do not. The second one, it's important for me to seek out people who work to address injustices in their communities. That was overwhelmingly yes. It's wonderful to see. And then finally, I work to elect policymakers who support the views of my professional organizations on important social issues. And again, overwhelmingly from this group, responses were yes. So it's all very encouraging. I'm not sure the results from this group are necessarily representative of the field as a whole. This is kind of a special group with respect to advocacy issues, but it is encouraging to see that we are on the same page with this. So I want to start by thanking Dr. Collins-Jones for bringing this issue to me to begin with. And I remember in our early conversations just not being sure. I mean, we're talking about how can we incorporate this into the training program, but also had a conversation about, well, if we're going to incorporate this into the training program, maybe we should be doing it as well, right? Maybe we should be out there meeting with legislators, connecting with the community in these important ways. And I just wasn't quite sure how I could do that. I'm ashamed to admit I had not done a lot prior to this, but one of the things that Dr. Collins-Jones said, I think was really powerful for me, and I'll share an example here of just what it can end up looking like. And what she said was very simple. She said, just show up. She said, just keep showing up and things will happen. They'll remember that you were there, and then maybe they'll ask your opinion at some point and maybe ask you to get involved. So I said, okay, I can do that. And I keep track of like Chamber of Commerce events and things in our areas. And one of the things that popped up was a meeting sponsored by I believe it was the Richardson Chamber of Commerce. And they had 2 Dallas County commissioners coming in to speak about mental health issues to the chamber members. And I thought, okay, that's it. And it was right after our conversation. And so I said, okay, I'm going to show up. And then shortly after I signed up to show up, I found out I couldn't show up. So I asked Dr. Collins-Jones to jump in for me. And that simple act of just showing up at this one meeting turned into a whole bunch of really meaningful, positive, and expanding engagements and opportunity on this front. So I just want to share that a little bit with you. So we had attended this community luncheon with the county commissioners, Dr. Collins-Jones did. And through that, we made, went too far. Through that, we made connections with not only the county commissioners, and you'll hear a little bit more about them shortly, but with a person by the name of Dana Bickford, who is leading a coalition. It's called the Coalition for Behavioral Healthcare in Collin County, which is one of the major counties in the Dallas-Fort Worth metropolitan area. He's the president of that. So we got connected with him, and then he connected us with leaders in school counseling at the school district, with superintendents at the school districts. Ultimately, we made a connection with the Grant Halliburton Foundation and are now starting to do some work with them. But this small thing turned into a whole series of meaningful opportunities for our students to connect with policymakers and legislators. It connected us to the school districts that ultimately led to a grant that for us to go into the school districts and begin to provide training to educators and administrators and parents around mental health issues, led to a grant to help us start an interprofessional, interdisciplinary clinic on the campus, and it just grows from there. So publicly, thank you, Dr. Collins-Jones. As you've heard, we've undertaken this project to begin to incorporate advocacy training into the clinical psychology program. And we completed all 3 of the workshops. And as you've seen, the exposure to that information did have an impact on our students. At this point, we can't really fully understand what that impact will ultimately look like, but I do think the results kind of beyond the movement of the data on the measure are really promising. As we have conversations with students, I think it has begun, these experiences have begun to shape the way they think about themselves within the field itself, what advocacy can look like for the field. So it's been very encouraging. And what I'll start with today is talking a little bit about the workshop I facilitated with our county commissioners, those local elected officials. Then we'll kind of move into some data that, for me, drives urgency around this type of work for our future psychologists. And then we'll, as Dr. Collins-Jones mentioned, we'll talk about some next steps that maybe we could take. So on September 12th of last year, we had these 2 county commissioners join our campus or visit our campus and join our students in a meeting for a dialogue. And during that dialogue, we covered kind of 5 specific areas. We asked the county commissioners to respond to the state of mental health in their respective counties, what they felt were the biggest gaps in healthcare, in the healthcare system, that we needed to work towards closing to improve so that we can improve access to quality mental health care, what they felt like the community of mental health care practitioners could do to contribute directly to closing those gaps. And we just asked them directly, is advocacy from us as a community of professionals important? And if so, why? And then what are some of the best practices that we can use as psychologists to engage with them, to engage with elected officials when it comes to advocating for mental health in our communities? And it may not come as a surprise to you, as I think that many communities across the country share similar challenges, but they shared that we're in the midst of a mental health crisis. Surprise, surprise, right? But it's interesting to hear that from elected officials. They said just very plainly, there are not enough mental health professionals in the community to serve those who are most in need. We in Texas, and I'm not sure about the state of this across the country and in your states, but they said we have a major shortage of inpatient psychiatric beds. Actually, over the last, I think, 50 years or so, psychiatric beds have been cut in half in Texas. And then half of those, again, are not available because of mental health care staffing shortages. And then they said we just lack the funding that we need to close the gap on these issues. They also shared that our county jails, not just in their respective counties, but all across the state, have become the largest mental health treatment facilities in the county. And we actually had a fairly recent report in the Dallas Morning News that noted that we had some inmates in our county jails who were determined incompetent to stand trial that have been waiting in jail for over 2 years for an inpatient, a long-term inpatient bed at a state hospital. So as far as addressing these issues, both of the county commissioners strongly encouraged engaging legislators. They said, we need you. We love that you're talking to us, but we really need you talking to the legislators in Austin and in DC. So they said that without that, we're not going to really get at the funding needed to address community mental health issues. We're not going to get the funding to expand inpatient treatment opportunities for our communities. And that kind of conversation with the legislators is going to help drive support for bringing new clinicians into our community. Overall, the event, I think, was really well received by our students. And we'll talk a little bit more about some of the student activity coming out of that meeting as we look towards next steps at the end of the presentation. I do have a video I would like to show to you really quickly that our communications team put together about that particular session we had with our students. And I had this link embedded in my PowerPoint and got in here and clicked it, and it didn't work. So I'm going to just switch visuals here for a minute because I did share it on my LinkedIn profile. So you get a peek at my LinkedIn profile really quick.
Feel free to friend him.
Commissioner J.J. Koch and Collin County Commissioner Cheryl Williams join us and speak to students. It was a great opportunity to learn about what the priorities are, what the challenges are, what the gaps are in Dallas County and Collin County, to hear from them about where they think the solutions lie.
We're in a place where we just don't have enough people that are qualified to help the folks that are so desperately needed.
It's the reality that we face that county jails, not just in Texas, but across the country, are the de facto mental health provider.
We hope to basically just gain a better understanding from their perspective of what's going on that legislative level, because as for us as students, we kind of have that clinical understanding and we're getting that educational background, but our goal is to be able to apply it to the community.
There's stigma coming from Latino, background of a Latino community. It's not something that is very well received sometimes within our family. So I think it's important that we address and we create awareness to help communities such as within the Latino community, Black and Brown communities.
So when we talk about social justice and advocacy in the classroom, we tell them about it, but we're not showing them what it would look like if they're actually doing it and what steps they can take to actually start to do that, even as a student, but something that they can develop throughout their careers.
One of the advantages of coming to a school like the Chicago School is that practitioner focus and our willingness to engage not only just our curriculum and the faculty and the educational process, but to connect our students with community resources, with organizations in the community that they will be serving, with elected officials that will be speaking to the needs of aspiring psychologists and counselors that understand the needs of the communities that our students are entering into, so that we can most effectively prepare them as practitioners to have an impact from day one after graduation.
I probably should have apologized in advance for the little ad for the Chicago School there at the end of it. Okay, so we've heard a little bit about some of the gaps in our communities from the commissioners, but I want to take a minute to share a data-driven story about the state of mental health care in Texas. The map you see here covers all the counties in the state of Texas, and each dark blue square on that map represents a county for which the entire county is a mental health professional shortage area. And recent data on access to mental health care services that's compiled by Mental Health America, looked at, again, access to care for both children and adults across the state. And then they did that for every state in the United States. And the state at that time with the best overall access to mental health care for its citizens was Vermont. And the worst, dead last, 51 we came in 51 was Texas, because they counted District of Columbia. So yes. The map itself is just about its practitioners per capita. So yeah. The Mental Health America report, and I would encourage all of you, if you haven't seen it, to go check that out on the Mental Health America website. They've got a brand new 2023 version of it up. Yeah, so Texas came in dead last. And if you look at the map, it's not difficult to understand why. There are many reasons for our access to care problem in the state, but I want to zoom in on one particular aspect of the problem, and that is to look at the number of psychologists that we have in the state of Texas. So the state of Texas has 254 counties and roughly 29 to 30 million residents. Across the state, there are about 4,800 psychologists, and that's about 16 psychologists per 100,000 population. Now, for the entire United States, if you look at the average across the United States, it's about 30 per 100,000, which still is not enough. But that number of 30 per 100,000 gets skewed a little bit for some of the higher density population areas in the Northeast, where the ratio is closer to 55 per 100,000. But most of the southern region of the United States has a ratio much closer to what we have in Texas. And what's interesting about that, and for me a little bit sad, is that out of the 254 counties in Texas, there are 143 of them that do not have a psychologist at all. So if we look at the population of all those counties, that's 1.7 million residents in the state that don't have a psychologist serving them. And if we kind of bring that scope out a little bit and we say, okay, well, let's look at the counties that have at least one psychologist as well, that brings us up to 172 counties out of the 200 plus counties, and about 2.5 million people in those counties. So there's a sizable portion of residents in our state, albeit rural and relatively not densely populated, that do not have access to the highest level of psychological care provided by a doctorally qualified psychologist. Now, interestingly, when we look at how psychologists across the state are distributed, about 3,000 of them, roughly 65% of the psychologists, are listed as living and practicing in only 5 of the counties in the state. So that's 65% of the psychologists practicing and living in 2% of our counties in the state. So now, obviously, the rapid growth of telemental health, I think, helps that a little bit and may improve access to psychologists for those living outside of those 5 counties. But the question still remains, what are the other 249 counties doing in our state to support access to high quality, doctorally qualified mental health care for their residents? And unfortunately, given the state of our workforce challenges, I'm not sure there's a lot that we can do. Now, if we look at some of the other states in our region, we can see the situation's not much better. In fact, when we look at the ratio of psychologists by population, the Texas region is the lowest in the country. So if you take all these states together, this as a region has the lowest ratio of psychologists per capita in the United States. So that's just that kind of that mid-south region. If we zoom all the way out, we look at the map of the entire United States, you see that minus just a couple of areas, West Coast, Northeast, the majority of the country is in a similar condition. If we look at this situation just for psychologists, again, a report that was published by SAMHSA back in 2015 suggested that at the time, just overall, we had about 180 to 190,000 psychologists available in the workforce. And what's been interesting to me is I've tried to dig into the data about where are we now. I find it tough to get a really clean read how many psychologists are actually out there engaged in practice. And but maybe one of the better estimates I figured was looking at the Bureau of Labor Statistics and all of the jobs that are out there for psychologists. So in 2021, the Bureau of Labor Statistics reported that there were about 181,000 jobs overall for psychologists of all categories. Now, roughly at that same time, the breakout of clinical and counseling psychologists suggested that there were about 58,000 across the country, and then another 57,000 school psychologists for a total of about 115,000. I saw a report from APA from that 2015, 2016 period that had roughly a similar number right in that same ballpark. Now, that SAMHSA data report back in 2015 was looking forward, attempting to look forward to what the demand would be for psychologists in 2025. And they estimated that we were going to need right around 200,000 psychologists in the workforce. And they said that that's if nothing major happens at a societal level that might drive the need for mental health care services up. Guess what happened? Yeah. So they said if that happens, we need about 240,000. And it looks like we're obviously going to fall short and may have actually moved backward since that time for the total number of psychologists that are available to provide services. And again, while we don't know the exact numbers, what we do know is that particularly over the last few years, we've had more psychologists retiring, reducing services, or just leaving the field than we've had new psychologists coming into the field. So in some ways, this data seems to kind of match up with what we hear about the profession, even if we can't get a 100% clear read on how many active practicing psychologists are out there in the field. So what do we do about it? And this is kind of, for me, as I've dug into the data, this is really a big part of what, for me, drives urgency around our advocacy efforts. So with our program and what we're trying to accomplish in the Dallas area, I think we're ready to do our part, and we've got several next steps queued up and ready to go for our students. So what's already happened, and you heard a little bit about this from Dr. Collins-Jones, is that our students have organized a social and political advocacy committee as a subcommittee of their student group, SITE, which I love the name of their student group, to help lead additional learning and advocacy opportunities for their fellow students. I'm working with 3 of those students in particular to develop a monthly report. So since, I believe, October and November, we've been putting together a monthly report on state and national advocacy actions so that we can communicate those to our larger student body. And then we're using that student work to also communicate with our local psychological association about those very same kinds of advocacy activities that we can engage in. An example of some of the engagement that we're seeing from the workshop series is that we had a group of students, a group of our PsyD students, attend a Texas legislator candidate forum through one of the local chambers. And their goal in attending that meeting was to just get an opportunity to speak with elected officials regarding mental health services in our communities. And I think that, to me, is a really important step for the students to take that they might not have otherwise taken had we not engaged them through this workshop series. So it's, again, very encouraging. We're currently looking, as Dr. Collins-Jones mentioned, toward a new series of trainings in the area of advocacy in the field for our students, taking their feedback on what they would like to see as far as further training goes. And we'll be implementing that training later this year and into next year, and really look forward to seeing how that evolves. In fact, this just came through last week. We're working to bring another member of the Texas State Legislature to campus to meet our clinical psychology students in February. And I think that given the early, really positive responses we've seen from the workshop series, this is something that we'll likely just incorporate into the curriculum. I do think we need to continue collecting data on this. So before this meeting, Dr. Collins-Jones and I were having more conversation about how we can integrate just ongoing data collection about the impact of this type of programming on our students. And I think and I hope that sharing this kind of programming, this type of data, information on advocacy for the field of psychology at professional meetings like this is helpful and I think important. And then finally, we'll be working with our other academic programs, our other kind of licensure-based programs on campus to figure out how we can adapt and port the advocacy activities of the PsyD training program for our other student groups on campus. So I showed you the video our communications team put together a little bit earlier. That touched on some of the student sentiment coming out of that workshop. The content for that video came out prior to, we did that content prior to the conclusion of the workshop series, but we've continued to get positive feedback from our students. So I wanted to share a little bit of that here. You can see, I'll just quickly read it. It was highly beneficial to hear from individuals that have great insight on issues related to social justice, whom at the same time wanted to hear from students about solutions on those issues. And it goes on, but for me, the last sentence in that paragraph is the most powerful, and it's the student noting about learning how to create change. So, for us, I think just delivering the workshops to increase student knowledge is not the goal of the project. The goal is behavior change. We want to increase knowledge, but ultimately with the goal of seeing behavior change among our students, creating a new generation of professional psychologists who understand the need for advocacy, who know how to advocate for the field, and then actually go into the world as active, engaged, and effective advocates for the field of psychology. So I think the next thing to think about for us as psychologists is, what is our role as active psychologists working in the field, be that in the clinic or in the classroom when it comes to advocacy. And I think a good place to start is to ask ourselves a couple of questions. So I've got those here. So those questions are, what's happening to the voice of psychologists beyond the office, beyond the classroom or the clinic? As a psychologist, what am I doing? Next is, who's actually out there leading the charge for mental health advocacy in our communities? Obviously, at a state level, we have our state professional organizations. At a national level, we've got APA. And for us in Texas Psychological Association, I think actually does a good job of staying engaged. But even for the Texas Psychological Association, membership has been falling year after year. And suggesting that psychologists across the state on an individual basis are not as engaged as they could be. And I think that falling membership actually weakens the collective voice of our state associations. So I think we need to think about who in our communities, not just their state associations, but who in our communities is leading the charge from a mental health advocacy perspective. Is it a psychologist? Is it a group of psychologists working together? Is it the local psychological association? And if we can't answer that very well, then maybe it's not psychologists leading the charge. Now, when I've engaged with community groups in Collin County or in Dallas County, what I often find is that there aren't any psychologists involved. It's professional counselors, it's social workers, and that's not necessarily a bad thing. But as psychologists, I think we have a special voice, a special level of expertise to offer around what our community needs are, and can inform support for advocacy actions in the communities. But I have, when I find that, I have to ask myself, where was I? You know, where are my fellow psychologists? And unfortunately, in many cases, at least in our neck of the woods, it's not us as psychologists. So the last question relatedly is, who's representing the field of policymakers and funders? Again, we know who's doing this at a state level, at a national level, but who's doing this locally? An example that I came across not too long ago, I mentioned the Grant Halliburton Foundation earlier, who we're engaged with now, but they put on a great conference, and it was a little earlier, it was last year. And so I took a look at the agenda. I missed the conference. I didn't know about it. I took a look at the agenda, and I saw that there was not a single psychologist on the agenda. And that's what Grant Halliburton does. It's mental health training and advocacy. There was social work, professional counseling, and applied behavior analysis represented on that conference agenda. And the topic was behavioral health and mental health care for children and adolescents. Where was I? Why didn't I know about this? Why didn't I do more to be a part of it? And it was just hard for me to believe that we didn't have a psychologist on the panel. So again, it's like, where are we locally? Where are we in our communities? And I think it has a lot to do with the need for us to just show up, to put ourselves out there, to represent the field, whether that's to funders or policymakers or community organizations. We've got to do more. So I think asking ourselves these questions is helpful. And as we start to kind of work through the answers, we've got to start thinking about some specific strategies. And I've got a few that I'll offer here. So I think the first, I think many of us in this room, I think we've got this pretty wrapped up, right? It's what a lot of us do or aspire to do, and that's just be a great psychologist. When we do good evidence-based work in the clinic or in the classroom, and the people we serve or the students who are part of our programs have great outcomes and are satisfied with us individually and more broadly with us as a field, I think that in and of itself is a solid form of advocacy. And so that's important to put out there. So I think that's a great place to start. And I think that's kind of where many of us in the field more broadly are at this point. So number one, let's just keep being great psychologists. And we need more of us for sure. But let's just keep doing what we're doing when we're serving the community through good clinical work. A second strategy is to just get informed about advocacy efforts, about advocacy efforts, legislative activity that's important to the field. We need to know who the players are when it comes to big, important societal issues around mental health. And there's some great ways to do that. Going back to our associations that represent us, the American Psychological Association has a great advocacy section of their website. If you haven't been there, I would encourage you to do that. On that site, they identify what they'd like us to do as psychologists, to take action on by reaching out to legislators. They have ideas there about how they would like us to get involved as psychologists. They even have a really nice one-pager that helps you think about how to engage legislators and how on policy issues. So it's very helpful. Our state psychological association, TPA, has a great advocacy section of their website. They provide quarterly updates about key legislative issues. And in fact, their Q3 report, their third quarter report, and their fourth quarter report from this past year were all focused on our upcoming legislative session in the state and what our policy priorities were as a state association. I mentioned Mental Health America earlier. They have a great advocacy section on their website, and NAMI as well has a very solid advocacy portion of their website. I think a third thing that we can do is identify and engage with our local elected officials and organizations. Reach out to them, let them know you're a psychologist living and working in the community. If it's an elected official, let them know that you're a constituent and that based on becoming more informed about policy and legislative and advocacy issues, you've got something to offer. We need to share with them what we think is important from our perspective about mental health in our communities. As far as organization go, I think we got to look out for who's out there in the community doing mental health advocacy work. I gave the example of the Collin County Coalition for Behavioral Health. I'm now on the board for the coalition. Prior to that, again, this is the Collin County Coalition for Behavioral Healthcare. Prior to me being on the board, they had no psychologist representation on the board. They had school counselors on the board, which is great, but no psychologist representation on the board. So I'm happy to be a part of that. But I think that's one of the things that we can do. And finally, I think it's just important to be a champion for the field of psychology. It's awesome to be a good psychologist and to do good work for the people that we serve. But what I think to be a champion for the field means is that we have to start thinking about scope of impact. How is what we're doing expanding the scope of the field, and who we're touching, expanding the scope of knowledge about what we have to offer as a profession. We know we have a major shortage of psychologists in the field right now. There's a tremendous demand for our services. So to be a champion, I think we need to just make sure our voice is out there, that it's being heard, that people know, that legislators know the value of psychologists to the health and well-being of our communities. And we know we're not going to close the gap on our need for services by just continuing to sit in our offices, whether that's clinical or classroom. We need the key players legislatively and at major nonprofit funding organizations to know us, not just through APA or our state association, but to know us personally, to know that the value that we bring, and to know that we support greater engagement for psychologists in these conversations. So some of the things that I think come out of that is we can get more students in the training pipeline, help us making sure that pursuing a doctoral degree in clinical psychology is more affordable and accessible. We can improve reimbursement rates for services among psychologists, particularly when it comes to areas like Medicaid. And we can do a much better job through this activity of incentivizing psychologists to move into and serve our rural populations. And then finally, for us in our role as educators, more specifically, I think just to be that model for our students. We talked about the training piece, and I think that's awesome, but I think we as educators have to be out there modeling this for our students as well. We need to train them and then bring them alongside us as we get into our communities with the elected officials, talking policy development with organizations out there and other key stakeholders to make sure that we are continuously elevating the voice of clinical psychology and share all that we bring to the table for making the world a better place. So, thank you. And I think we have a few minutes for questions.
So I really like your the public health approach to intervention or advocacy. You have the system, you've got the community, and you've got the individual. Having made probably 15 or so visits to the Hill, I can let you know that the most powerful voices are the students' voices. So if you can get them in that advocacy system, that is a very powerful way to do that. I'm also wondering if you're very excited about the $33 billion surplus that Texas has, and their legislators are trying to figure out what to do with that. I did read the governor's and lieutenant governor's priorities, but I don't remember mental health being at the top of that list. Do you? Maybe I missed it somewhere. Did you see it anywhere?
I did not. But what I will tell you, though, is that, again, meeting with some of the individual legislators representing the Dallas County, the Collin County areas, we attended one just a month or so ago, and to a person, they mentioned mental health as being a priority for them going into the legislative session. We do have a massive surplus this year. We have a $133 billion surplus and about $1 trillion in ask around that money. So how it gets distributed is yet to be seen. But I am encouraged that when speaking with individual legislators, that mental health is high on their list of important things to address in the coming session. We'll see how it turns out, though. Just give us $1 billion, right?
When we went to that meeting, I can't remember who was the man's name. The one there were three individuals, like House Representatives and state senators, and one individual started speaking about his interest in mental health, and then he said the one thing that we jumped on: "My father is a psychologist." Bam! We now know we need to go talk to him. So we did go talk to him, and we were given his card in his office, and he has asked before he goes into session if he could have like a Cliff Notes version of what are the important issues so that he knows what to look for and what to advocate for. That was eye-opening for me, that they don't have the ability to do all that work. If they have somebody giving them that information, then they can advocate. So that's kind of a hole that we can fill, is to give them the information that's really important for us, which is access to care, especially in our state.
That was Senator Nathan Johnson. And fortunately, I'm meeting with him in Austin next Thursday. So, but as open and informed as he is, we also have legislators who just, again, don't know, and they're being misinformed through other channels about mental health needs in our communities, about the role of the various mental health care practitioners in our communities. So, having these conversations is critically important. Is the mic still back there?
Yeah. I just want to thank you for the work you're doing to advocate for mental health overall. And I really wanted to just bring some extra attention to the reimbursement rates. I'm borrowing from what teachers have started to talk about, like, let's stop talking about a teacher shortage and let's start talking about why teachers are not attracted to teaching. And I've really noticed in myself, I was strongly committed to community mental health, working in places where underserved communities could actually get treatment. But the pay was so dismal, and the workloads were so high that it didn't make sense, like, for me just to be able to live and do that work. So we really need to think about how we're going to correct, sort of caseloads for folks, and how we're going to actually draw people into not just the profession. We can draw as many students as we want into the profession, but they're going to keep filtering back out into private practice where they need to have direct pay so that they can have a schedule that's manageable and people that, and a pay that's reasonable. And I feel like just the social justice piece for me is that there's an undue burden placed on people of minoritized identity who want to give back. A big reason to get involved, to become a psychologist, is to give back to their communities and find themselves in underpaid work, very highly stressed, with everyone bringing every kid to them who matches their identity, and then being expected, if they're bilingual, to also do translation. I really think we need to be thinking about the economics of reimbursement for psychologists if we want to attract students into the field.
I absolutely agree. And it's a story we hear again and again. People they go into the field with an idea about who they would like to serve, how they would like to serve, what they would like to do with their education and their expertise. And reimbursement rates are a big part of it. Another part of it is the student debt issue, right? That if they're going to make those payments afterward, and there's more opportunity for adjusted payment schedules now than there ever has been. So I think that's great. But I think that's on the other side of that is funding for student education, loan forgiveness programs, and expanding that. So in Texas, we have a loan forgiveness program if you work in a mental health professional shortage area that hasn't been funded. It's been empty for four of the last 5 years. So I'm hoping that with that $133 billion, we can refill that fund.
Even if I had no debt, I would be pretty reluctant to work for less than half in a very toxic workplace in a lot of places.
Absolutely.
I just looked at the job listings in Texas, and by the way, many of them pay very well, I noticed, because there is this shortage. And I went and looked at a few that looked really nice. They were actually asking for psychologists, not any mental health clinician. And then I went to the page for the agency, and they all were like, "Oh, it's so hard to get reimbursed. We don't actually take insurance." I was like, "Wow, that's heartbreaking." There are all these jobs in a place where there's a shortage, and they're not actually able to serve the community.
Yeah.
The shortage. Oh, I'm sorry. Go ahead.
I was our community mental health center in Dallas. They used to call them MHMR. Now it's the large one is MetroCare.
MetroCare, yeah.
And they have not. They don't even have a psychologist in their only in one division. The rest they are all LPC. So we approached them to put practicum students there, and they have a shortage. They have over 75 openings for clinicians. They don't have a psychologist, and they will not. When I talked to their director, he said, we can't afford to pay a psychologist. And I said, then why aren't you all applying for something like the National Health Service Corps and getting people in? And then you could have a licensed psychologist in your facility, and then you could become a training site. And so he didn't even know that the National Health Service Corps existed. I'm a little biased. I was a former member of the Corps. So I'm like trying to tell him, you need to be hiring psychologists. People cannot get services. Folks are on waiting lists for over a year and a half to get, if anyone wants to get their child evaluated. The wait lists are just so enormous. It's just very sad.
Yeah. I was going to say, we have a state hospital, brand new state hospital that was built outside of San Antonio that can't open because there are not enough people to staff it.
So just one more issue I wanted to make sure this audience is aware of. There is a bill that we're working on with APA, Alex Ginsburg there. It is for, we're working with 5 different senators' offices, Wyden from Oregon, Stabenow, Michigan. We're also from Wyoming for covering CMS eligibility for psychology trainees, both psychology interns and psychology postdocs, trying to get these more stabilized providers in these rural areas specifically, not just going to academic medical centers, but more rural areas too. It's a long shot that they're going to fund. CMS is not really supportive of this. It's along with psychiatry, who, similar to family medicine, you may know, are exempt from having a faculty member in the room. We're asking them to add psychiatry and psychology to CMS funding for this to help support psychology training programs. And this should surface in the spring sometime. It's a kind of a long shot that will be included in that, but if it does come up, please write your senators, et cetera, to support this.
Thank you so much for the presentation. I really enjoyed it. And I was just curious, I serve on a state board, and my experience with legislators is that they're really good at giving speeches and not so great at listening. So I'm curious, when you talk to your students about how to make those interactions the most useful, like what do you recommend? How do you help them think about how to engage the legislators?
Well, I think the best piece of advice we received from Dr. Breckenridge, who is also, she's an attorney and, PhD, and she said, show up, come prepared with information that you have, knowing the impact on your community, and share information. Yeah. And you don't just share it one time. Make these people a familiar face. See them frequently and provide them with information. Yeah. And when we talked to the senator that was there at that meeting last month, that's what he said. If you can give us information, that is great. Yeah. I had no idea that they needed that.
I think that's a really important aspect of it, is to know what their agenda is, know them, know what their priorities are, and then come in willing to help support whatever those priorities are through your role as a psychologist. And I think doing that again and again, showing that you're invested in supporting them, because their goal is to get reelected, right? So if they have priorities and agendas that align with what we're looking to accomplish in the field, and we can support that, we become a resource for them, and we show up again and again, then they're going to see us as a reliable source and maybe more effectively listen to what we have to offer.
So I really appreciate this. I've done a lot of work just kind of on my own, because I very much so engage in advocacy in Arizona. And I think one thing when it comes back to kind of the student process, we've talked a little bit about incorporating the social justice class, just maybe not sure how to do it. So you'll probably hear from me. So being able to have the training, and I think that that's so much of what we've missed. And I don't know about you guys, but when I was in my doctoral degree program, there was nothing about psychology as as a position of authority, as a position of legislative authority, I guess, and an ability to speak with our elected officials and be able to have some of those conversations that offer our voice. And we certainly don't see psychologists in Arizona in those positions, and taking the lead. And so I very much so agree with you with us being seen in that field and heard in that way, and teaching our students how to do it. My concern is that many of us don't know how to do it, and none of us were trained how to do it. And personally speaking, having to stumble through learning how to be an advocate and a psychologist, and something, and I'm hoping you can speak to this, I guess, is, and this really has nothing to do with the university that I work at, but maybe more of my own, like, I don't know if that's okay. And doing it anyway, and just wondering if maybe it gets to people and then they find out and then tell me that I shouldn't. But during, I've engaged students to come with me to the Women's March, and during Black Lives Matter, myself and several of our students went and marched for the Black Lives Matter movement, and engaged in our state association. In Arizona, I was the president last year, so I just kind of finished that presidency, but kind of engaging in our legislature in that way. And I wonder if anyone, or if you can speak to, if there's been any, I guess, backlash maybe almost, or any concern from the university with engaging in social justice, especially if it maybe speaks against some university policies.
We haven't had any pushback or backlash at all. I probably try not to do direct advocacy work in violation of university policy. Might get in trouble for that. But we haven't had any kind of constraints really placed on the activity that we've engaged in. But there are some, my understanding is there's some pretty specific rules around what constitutes lobbying and the kinds of activities that you can engage in as a nonprofit institution. And so I think it's important to get informed about what the parameters of that look like, so that you don't inadvertently jeopardize the nonprofit status of your university. That could be a problem.
The public health programs have a lot of training in advocacy and lobbying, and they explain things. I have all the information. When Dr. Breckenridge came and gave that was her lecture, and I have a lot of information. If anybody wants it, we'll give you our emails.
Sure.
If you want to put that next one. But other fields do this. That's a part of their training, and we don't.
Yeah.
And so we basically took the public health model and just took the best parts of it that are more applicable, and that's what we gave them during that 3 weeks. That was it. We borrowed. It wasn't like we created anything. We just used it with our students.
Yeah.
So
I think we had one maybe final question in the back. And I think we have to wrap up at that point.
Hi. I was just wondering what would constitute, I guess, the threshold for a mental health crisis, especially given the numbers that we saw for the state of Texas, but other states as well, for I guess state governments to fund, give money, because this is, even before pandemic, this is a crisis that needs to be drawn attention to. Otherwise, I don't know how prioritized mental health would be with legislators.
Mm-hmm.
I know they draw a lot of attention, or they push for agendas that the constituents like vote for, or like harass them for, right? And a lot of problems when and I'm seeing, like, when I used to lobby at state capitol in California, in Sacramento, it was passing a bill that was a legislator's like sort of baby, like that they really were invested in. But then after being voted on, it had to go to like a financial committee, and for it to be, can we do this fiscally, right? And a lot of times it'd be, well, no, right? And so I don't know, in your experience, and maybe if other people have experience in their states, like what would constitute like a threshold for this being like a state crisis?
It's a great question. And I don't know what the threshold is, except that every legislator that I've talked to of late is talking about it. Before I bring it up, they're talking about it. And I think that they do see it. They feel it now in their in their communities with their constituents. And I think that's where the pressure is coming from. And I think it's important for us to remember that we're the constituents as well. And so we need to put pressure on our legislators around issues related to the crisis. I think what the World Health Organization said, globally, anxiety and depression went up 25% across the pandemic. And what we keep hearing is acuity of mental health problems, not just the number of kids with mental health problems, but the acuity of their mental health problems in the school is just off the charts. And our school counselors and our school psychologists are just completely overwhelmed and understaffed. So I think legislators are hearing it much more clearly now. Hopefully they're listening.
I really appreciated what you said about how you're borrowing from public health, right? So I actually come from outside of psychology. I think part of the reason why I was brought in was because I come from a field that's interdisciplinary and transdisciplinary. So I asked this in a different session earlier. I was wondering from your perspective, what is the field of psychology doing to sort of break those disciplinary lines? Or you mentioned earlier there's interprofessional and interdisciplinary clinics happening. How is that working, or is that happening more so that we can create sort of this global advocacy effort across disciplines?
I sure hope so. My background is in pediatric psychology, so I worked within a hospital and I worked with a variety of professionals. And the sum of the parts is greater, than the whole. Like I really believe we need to be connecting with our colleagues, in different professions. And I want our students to learn that. We talk about interprofessional development and how important that is. We need to show them that. We need to have that. And, having conferences and having, even workshops where we bring everybody together and sit around a table, it doesn't help us to do everything in silos. It's much better if we can all work together. And I think that's something that we all should be trying to do to work with the whole person, right?
Yeah, I agree. I was going to say, I think we do that a lot in health psychology. It's my background as well. The Chicago School every year has an interprofessional conference that we have that we're trying to expose students from across disciplines and faculty from across discipline to what's going on in the different programs. We have high hopes for the interdisciplinary clinic that we're trying to develop in Dallas, but it's still very early stages. But again, that's the goal. How do we get our students across programs working together, better understanding the roles that each of us play in the process? And I think that probably brings us to the end of our time. The poll. Okay.
Please complete your poll for your CEUs.
Thank you so much, everyone.
Thank you all.